Good evening, everyone. I'm Dr. Jyoti Patel, and for those of you who don't know me, I practice internal medicine and pediatrics here in the Valley. And today we're talking about muscle and bone health. So I'm going to keep my chat open here on the side for you guys. Feel free to use the chat during the presentation so that if you have any questions or you have any comments, feel free to join in the chat. So let's get started. So just, getting started with this presentation, how many of you struggle with decreased muscle strength, increased joint pain, bone loss concerns, risks for falls or fractures, worried about losing your mobility, or even just something simple like carrying your groceries or climbing stairs, or living independently as you age? So if this is something that concerns you, feel free to write yes in the chat. This is probably why most of you have shown up today, and such an important thing to recognize. So now I've got some facts for you here. Did you know that 1 in 2 women over the age of 50 are at risk for osteoporosis? That's 50% of us. And we lose about 1 to 2% of muscle every year, starting around the age of 35. And there are more fractures every year than heart attack and stroke cases combined. Now, I've got a question for you. Do you know the percentage of people who will die within 12 months of a hip fracture? What percent do you think people will die within 1 year of a hip fracture? It's 30%. This, again, is a statistic it's astounding to realize that this disease we call osteoporosis and bone loss and muscle loss can actually be life-threatening. So here's something that I share with a lot of my patients. Unfortunately, the place that we're at in our current healthcare system, it only intervenes after there's been a significant loss of bone, a fall, or a fracture. And on the medical side, as a medical provider, the only tools available sometimes are prescription medications to slow down bone loss. But they can't cure osteoporosis, and these medications can have significant side effects. And on the other hand, muscle loss is rarely measured in the medical community or addressed in the medical system. And there are no medical treatment options for muscle loss we call sarcopenia. So, from the way I look at it, it's critical that we are proactive with prevention. So, if you agree with me that prevention is better than cure, comment yes in the chat. So, now I have some more things I want to ask you in the chat. If you know, Jean, go ahead and mute if you don't mind. Let's talk about what makes up bones and muscle. So, what do you think makes up bone? Without cheating and going to Google, what do you think bones are made up of? And what do you think muscles are made up of? Calcium? Okay. Anything else? Protein? Yes. Love it. Any other thoughts? So I'm going to talk to you a little bit about it, because how do you make something if you don't know what it's made from? If you wanted to bake a cake, but you didn't know what the ingredients were, what is your cake going to look like, right? So it's important, if you're here tonight to learn about how to make strong bones and strong muscles, you know exactly how to make strong bones and strong muscles. So I want to talk you through building bones is like laying down cement. The first thing you need is you need the framework, the scaffolding. The second thing you need to do is pour the cement into that scaffolding. And the last is you need an enzymatic reaction to harden that concrete. Your bones are exactly the same way. Think of collagen as the framework. 25% of your bones is made up of collagen, especially type 1 collagen. This creates that framework for that calcium and protein to lay into that framework, making the bones strong but flexible at the same time. And collagen, especially type 1 collagen, is made from specific amino acids, and you need vitamin C to make collagen. So if you're not getting this in your diet, if you're not taking in collagen through animal sources, supplementation, and pairing it with vitamin C, this is something that is critical if you want to create that framework. Now, if you're going to see your regular doctor and you do have osteoporosis or bone loss, write these tests down. Have them check these tests. You can get at any labs, SonorQuest, LabCorp, and these are markers to tell you if you're losing bone or if you're making bone. All right. So this is a very critical aspect of figuring out what's happening. Did you know that 50% of your bone is made of protein? Think of it as the concrete that you're pouring into the framework. 80% of your muscle is made from protein. So protein is a crucial factor when it comes to bone health. And most of the women that I treat have a hard time getting enough protein in their diet. But if you truly want to build strong bones and you want to build strong muscles, you have to aim for at least zero 0.8 to 1 gram of protein per ideal body weight, pound of ideal body weight. Now you can get it through vegetarian sources or clean animal sources. But if you're not sure if you're getting the right amount of amino acids for bone and muscle growth, you can get a micronutrient blood test that looks for amino acid deficiencies. And more to come later. 25% of your bones are made up of calcium. And now think of it as that enzymatic reaction to harden your cement, and that's what calcium does. Calcium makes up the majority of the minerals that make your bones hard. You can get calcium through dairy products, dark leafy greens, fortified milk alternatives, canned fish with bones in them. Remember that you need vitamin D3 and vitamin K2 M7 to metabolize that calcium, to absorb it from your gut and move it into your bones. Now, in addition to calcium, there are other minerals that help mineralize your bones: phosphorus, magnesium, potassium, zinc, and copper. And if you're not sure that you're getting adequate amounts of these minerals, you can get a micronutrient test to see what your levels are and optimize your levels for better bone and muscle health. So now you might think, well, bones and muscles are really just for my frame, to make me look strong, to make me look healthy. But did you know that your bones have other health benefits? Did you know that your red blood cells are made inside your bones? Your white blood cells that help you with your immunity are made inside your bones. Bones are also a reservoir for minerals, amino acids, and fat. And muscles not only support your bones, but they help you with insulin resistance. They help you with blood sugar balance. Your muscles release chemicals to give you endorphins, help you with mood. When you move your muscles, it actually stimulates brain health and cognition, but it also supports immunity and inflammation. So remember, when we're talking about bone and muscle health, we're talking about longevity, cognitive health, cardiovascular health, hormonal health, everything about. So there are some risk factors for people that are more susceptible to losing bone and muscle. These are things you can't change. Women are more prone to muscle loss and bone loss than men. If you have a genetic history, a family history of osteoporosis or sarcopenia, or having problems with maintaining muscle mass and bone mass, you might have a problem. And of course, as we age, we also have things we can't control. But guess what? There are so many things that you can actually control. So let's talk about some of those things. What you eat matters, because remember, your bones are made up of collagen, protein, and minerals. So important to make sure that you're eating for your bones and your muscles. If you're sitting all day long in front of a computer or on your couch or in your bed, that sedentary lifestyle increases your risk for muscle loss and bone loss. If you smoke, if you drink alcohol more than 2 drinks a week, if you have bad posture, if you have chronic medical conditions, if you're lean and have a body mass index less than 20, or if you're taking certain medications, these things can put you at risk for osteoporosis and sarcopenia. So, taking a moment, is there anything on this list you can think of that you can do better at? If you feel safe enough to chat, let me know what you're working on. So, as a physician that works in the medical field, but also with a functional approach, there are two parts to fixing your bone muscle problem. First is the things that you're going to work on, which is optimizing your nutrition, doing load bearing exercises, managing your sleep and stress, removing anything that might be thinning your bones, like caffeine, like alcohol, like cigarettes, working on balance and fall prevention, and cleaning up your environment, toxic chemicals. On the medical side, thank you. Sitting in BMI, yeah, I'm all in with that one. So, with the medical aspect of fixing the underlying root cause, you may want to work with a skilled provider that can help you decrease inflammation in your body, remove any toxic chemicals, heavy metals that might be affecting bone and muscle health, fix the underlying chronic inflammatory conditions like diabetes and heart disease and hypertension, obesity, so many things that can influence your bone and muscle health. Also, you want a doctor that's willing to work with reducing the number of medications you're taking, look at your hormone health, and be willing to work on your gut health with you. So, these are some of the tests that a functional doctor may do to look at your bone health. We look at your micronutrient testing. We talked about looking at your amino acids, fatty acids, vitamins, minerals. We look at your inflammation markers. We optimize your hormones because that is so critical to bone health and muscle health. We might be looking for sources of inflammation like food sensitivities or gut dysbiosis or something called leaky gut, where the lining of your gut becomes porous and all the toxic waste, byproducts of food consumption gets leaked into your body, causing systemic inflammation. And that inflammation downstream, guys, can affect your bone and your muscle health. And there are tests that you can look at on a regular basis to see if you're breaking bone or building bone. NTX and C-telopeptide tells us if you're accelerated the bone loss, and the P1NP tells you if you're building bone. So most of you have probably seen a bone density scan. How many of you in the chat have had a bone density scan? Let me know. If you've had a bone density scan, how many of you know what it means? So you've had one, Tammy? Yeah. So here's the thing. Most people have had one. They don't really know what it means. So here's a very simple thing you need to know. You need to ask your doctor what your T score, T as in Tom, T score is. If your T score is anywhere from -1 to the plus side, you're in good shape. If your T score is less than -2.5, you have osteoporosis and are increased risk for having a fracture. Okay. So you really want to make sure that you know what your T score is. And a lot of times when you're told your T score, you feel like it's a finite thing. But did you know that your entire skeleton changes over every 10 years? You are not the bones you had 10 years ago. You are a whole new set of bones. So you can change and improve your bone density score if you're working on it with your doctor. Now, another test that we do here in the clinic is a body composition test. Let me know if you've had one of these. This is measuring how much muscle you have, and that you can actually track month after month. Let's say you're working out with a trainer. Let's say you're working out with a doctor that's helping you with your body composition. You can actually measure your muscle mass and your muscle distribution so that you know that you're making improvements. Shireen, you've had one. I know you have. So test, don't guess. Now, bones and muscles are built in the kitchen and strengthened in the gym. So I also mentioned early on that high quality protein makes up 50% of your bones and 80% of your muscles. So make sure you're optimizing your protein intake. Collagen rich foods like beef bone broth and eggs and chicken and fish or poultry or supplements of collagen type 1 can help with that. Omega-3 fats, super important for decreasing inflammation in the body, but also helps with muscle and bone health. Vitamin D, K2, M7, vitamin C, all really important. And of course, add minerals to your diet because that is what causes your concrete to harden. The things that are causing you harm is the standard American diet. So if you're doing a ton of factory raised dairy products, animal meats, sugar, salt, flour, processed foods with colors, dyes, preservatives, refined oils, these things are going to help break down muscle and bone. If you're doing a lot of caffeine, alcohol, smoking cigarettes, you're stressed all day, you're sedentary, you're not aware of the amount of toxic load you have in your body, this might be the underlying root cause of your muscle bone loss. So what should you do instead? You should increase your whole food consumption. So if you can identify it in a farm, eat it. Try to go organic when possible. Try to reduce your chemical load like pesticides. Do more plants when possible. and well-sourced proteins, omega-3 fats, seeds, nuts, colorful fruits and vegetables, optimizing these key nutrients, calcium, vitamin D, K2, silicon, boron, magnesium, copper. Try to do load bearing exercises. And I'm just going to let you know we have a special guest today. We have Shane Sullivan, who is a well rounded clinician who's going to talk to us all about optimizing our bones with exercise. So he's coming up next. So stay tuned for his amazing talk. But you want to also include mindfulness and yoga and meditation for stress reduction because that's going to help your bone loss. Now, you can build muscles and bones in the gym. So resistance training is key. If you're not going to the gym at least 3 to 5 times a week, you need to make that your goal for this year. It's important to have variety with your workouts. Do compound exercises like squats and deadlifts and bench presses and overhead presses. You can start with light weights, but it's really important to progressively overload those muscles to stimulate growth. Change up your routine so that you're not working the same muscle group each time. Try to incorporate other types of exercises like explosive movements, heel drops, isometric holds like planks, using a vibration pad, or even just walking every day is going to help strengthen your muscles and bones. Now, when I see patients in my clinic, oftentimes people want to know what supplements can I take? You can't supplement away a poor lifestyle. So this is an adjunct to everything I've talked about so far. But there are certain things that we want to optimize in our health, like vitamin D and K2 and calcium and magnesium and potassium and silicon and boron, copper, zinc, magnesium, selenium, and iron. So oftentimes when people come to my clinic, I do a micronutrient test to see what they're doing well and what they need to optimize. I try to improve their diet with them first and then supplement second. I did put here at the end of the list is hormone replacement therapy. I can talk another hour about hormone replacement therapy and how important it is for bone and muscle health, but we'll save that for another talk. And if you're not taking hormones, it's really an important discussion to have with your doctor. Muscle supplements. So I have a particular pre-workout and post-workout regimen that I'd like to share with you. Not everybody needs to take everything on the list, but if you want to improve your blood flow, your alertness, your focus and your energy levels and your endurance, sometimes taking a little bit of caffeine and arginine before the workout can help with that. If you want to improve your muscle growth, strength, and reduce soreness, I often will recommend creatine and some branched chain amino acids and a compound called alpha ketoglutarate as my pre-workout routine. Post-workout, we want our muscles to heal. So taking protein supplements can help with that, especially whey protein in women over 60 has been shown to be helpful. Optimizing DHEA, which is a precursor to testosterone, can be really helpful, especially in women over 60. There was a great study where 100 milligrams of DHEA helped improve bone and muscle mass in women. Glutamine helps with recovery, and so does magnesium. So before I hand off to Shane Sullivan with the next part of our talk in optimizing muscle and bone with exercise, I want you to know about a new mastermind group that I'm starting. People who are interested in building, optimizing muscle and bone are finally going to get their answers to these questions. To strengthen my bones, which vitamins and minerals should I take? To build muscle, what amino acids am I deficient in? Are there foods that are causing my inflammation? Do I have leaky gut? And if I do, how do I measure how bad it is and what's causing it? So if you join the mastermind, which I'm going to tell you about in a second, you get included in this a micronutrient test, a full hormone panel, food sensitivity panels. You even get an additional test to look for leaky gut and to look to see if you are sensitive to wheat. You will have a brief video from me interpreting your test results and supplement recommendations, and my free PDFs on bone and muscle building guides, along with a 1-hour group Zoom call with me on questions and answers regarding your particular test results. So if you're interested in that, this program is for people who are looking to kickstart a new lifestyle change with data and biohacking. And the program cost is $8.99. But just to let you know that if you tried to buy these tests at retail price, they would cost you $1,500. And by joining the mastermind, you would save $600. But let's say this is not for you. You really want to have more one-on-one time with me to discuss your case. You can create a discovery call with me by calling or visiting our website so that we can see how we can work together.